To governors to choose. If Parliament chooses to go ahead with assisted dying, it is making a choice that this is an area to prioritise for investment.
You're opposed to the assisted dying proposals.
Yeah.
You say the NHS can't cope with it, can't do it safely, but you will be the person who has to deliver them if they get passed. And I wonder, how can you be the health secretary who delivers on assisted dying if you fundamentally think it's the wrong thing?
Well, I'm a parliamentarian. I respect Parliament and I respect the rule of law. And we, as a government, are neutral and would abide by the will of Parliament. So,
But you don't think it's good. You don't think the NHS can cope with this,
Parliament
do you?
votes it down, well, I think it would be a big change. There would be resource implications for doing it, and those choices would come at the expense of other choices. And of course, we'd need to work through with the medical profession what would be a very new way of working.
That's interesting,
And
actually. So it's
I
not
think
budget.
no one should be compelled, for example, to take part in assisted dying if they've got moral or ethical objections as clinicians. That certainly would be one of my red lines. And that's one of the reasons why, whatever my own vote on this, I do welcome the debate. I welcome the debate in principle, and also welcome the debate in practice.
But it's not been budgeted for. Just fine on this point, Wes Streeting.
No.
I know you've got to go. It's not been budgeted for. So whatever happens in this area, you'll have to find the money. If it does get accepted, you'll have to find the money from somewhere.
Yep. To governors to choose. If Parliament chooses to go ahead with assisted dying, it is making a choice that this is an area to prioritise for investment, and we'd have to work through those implications.